Someone is severely bleeding, wash your hands to avoid infection and put on gloves. If the wound is abdominal and organs have been displaced, don't try to push them back into place. Cover the wound with the dressing. Have the injured person lie down and cover that person to prevent loss of body heat. Secondly, while wearing gloves, remove any obvious dirt or debris from the wound. Then apply pressure directly onto the wound until the bleeding stops. Don't try to remove the gauze or bandage. Squeeze a main artery if necessary. Immobilize the injured body part once the bleeding has stopped. If you suspect internal bleeding, call 911 or your local emergency number. Broken or fractured bone. Do not move the person except if necessary to avoid further injury. Call 911 or your local emergency number if the person is unresponsive, isn't breathing or isn't moving, then begin CPR. If there is heavy bleeding, if even gentle pressure or movement causes pain, if the limb or joint appears deformed, if the bone has pierced the skin, if the extremity of the injured arm or leg, such as a finger or toe, is numb or bluish at the tip, if you suspect a bone is broken in the neck, head, or back, if you suspect a bone is broken in the hip, pelvis, or upper leg. Abdominal thrusts or the Heimlich maneuver on someone else. First, stand behind the person. Wrap your arms around the waist. Tip the person forward slightly. Then, make a fist with one hand. Position it slightly above the person's navel. Then, grab the fist with the other hand. Press hard into the abdomen with a quick upward thrust, as if trying to lift up the person. Perform a total of 5 abdominal thrusts, if needed. If the blockage still isn't dislodged, repeat the 5 and 5 cycle. To perform CPR, first place your hand on the center of the person's chest and with the heel of your hand, press down by 5 to 6 centimeters at a steady rate, slightly faster than 1 compression a second. After every 30 chest compressions, give 2 breaths. Tilt the casualty's head gently and lift the chin up with 2 fingers. Pinch the person's nose. Feel your mouth over their mouth and blow steadily and firmly into their mouth. Check that their chest rises. Give 2 rescue breaths, each over 1 second. Continue with cycles of 30 chest compressions and 2 rescue breaths until they have begun to recover or emergency help arrives. There are 3 kinds of burns: first-degree burns, second-degree burns, and third-degree burns. When someone has a first-degree burn, the skin is usually red. There is often swelling, and pain sometimes is present. Treat a first-degree burn as a minor burn unless it involves substantial portions of the hands, feet, face, groin, or buttocks, or a major joint which requires emergency medical attention. When someone has a second-degree burn, blisters may develop. Skin takes on an intensely reddened, splotchy appearance. There is severe pain and swelling. If the second-degree burn is no larger than 3 inches in diameter, treat it as a minor burn. If the burned area is larger or if the burn is on the hands, feet, face, groin, or buttocks, or over a major joint, treat it as a major burn and get medical help immediately. For minor burns, cool the burn, cover the burn with sterile gauze bandage, take an over-the-counter pain reliever. Minor burns usually heal without further treatment. As a third-degree burn, fat muscles and even bone may be affected. Areas may be charred black or appear dry and white. Difficulty inhaling and exhaling carbon monoxide poisoning or other toxic effects may occur if smoke inhalation accompanies the burn. For major burns, call 911 or emergency medical help. Until an emergency arrives, follow these steps. 1. Do not remove burned clothing. 2. Don't immerse large severe burns in cold water. 3. Check for signs of circulation, like breathing, coughing, or movement. 4. Elevate the burned body parts or parts. 5. Cover the area of the burn.